Bonjour, bonjour, mes amis. It is wonderful to be here with you this evening, as well as to be here with our guest speaker this evening. We are in for a treat insofar as the DNA company's chief medical officer, Dr. Boyce Burkle, is here with us to have this conversation where we are going to discuss cancer and ways and thoughts that can go about its prevention. Dr. Burkle, welcome, sir. How are you?
I'm I'm fine, and thank you for the welcome.
Yeah, yeah.
A
I think,
hearty welcome to our guests this evening. We're happy that you're here. Your being here shows us that obviously you take your health seriously and you take your health as the sacred trust that it is. Life is a
mhm.
gift, but health is a trust.
Mm,
And we're expected to take care of our health. So I'm going to ask you a question I usually ask my patients, more as a conversation piece than otherwise, but I'm going to ask you and you can answer. Do you have insurance? And
All
most
right, on.
people, most
Yeah.
people say, yes, I have insurance. And at that, I smile and look at them straight in the eye and say, no, you don't. And look at the puzzling look on their face, because many of them say, well, Mr. Doctor, I just paid the insurance bill yesterday. I have I have the receipt. I say, well, what you have is sickness insurance. Health
Mm,
insurance is what we are here to do today. By taking a proactive approach to your health, by doing the things that we will go over today, and the
mhm.
things that obviously you are doing or wanting to do, that's why you're here, that is health insurance.
Yeah, yeah, yeah. I
So,
like no, I like that definition, and I like that we had a comment. Someone was like, "Oh, I'm Canadian. I have it. I'm covered." And then I like the right turn. You were like, "Not yet."
Okay, yeah. So a lot of what I'm going to say is to get us into the right mindset, a way
Mm,
of looking at things, because how we react and how we respond is how we look at things. And most of the time, how we look at things is how we've been conditioned to look at things. But many
mhm.
times we have to make the changes, look at things in a different way, because in looking at things in a different way, we have a different approach to how we deal with them. My mother had a saying, and I'll mention it to you, that has had an influence on my life. Two men looked out of prison bars. One saw mud and the other saw stars. So,
Mm,
regardless of your circumstances, it's not where you are, it's where you're looking.
mm,
If you're looking down, you're going to see the mud. And if you're seeing the mud, then you are in despair. If you see the stars, then you are in hope and
mm,
looking and thinking of the possibilities. Two men looked out of prison bars. One saw the mud, one saw the stars. Tonight,
mm.
let's look at the stars.
I love that. I love that because I think sometimes, especially when it comes to this big, ugly C word, there's a lot of temptation to put your head in the mud because then you just don't have to see it or address it. Right.
Okay, okay. So a couple of things, a couple of principles to keep in mind is an ounce of prevention is worth a pound of cure. So if your mindset is on looking at the stars and looking in hope, and that's your modus operandi, that's the way you think, that's the way you look at things, regardless of the circumstances, then an ounce of prevention is worth a pound of cure. And we know a wise man foresees the danger and hides himself, protects himself. The simple pass on and are punished. So, wisdom, we understand, is a principal thing. And as a principal thing, we need to acquire wisdom.
Mm,
And we need to acquire wisdom as it relates to life, where we need to acquire wisdom so much more so as it relates to our health. Because, like we said, our health is a sacred trust. Now, many times we are in good health and we take it for granted. And that's the problem.
Mm.
Another saying from my mom, you never miss the well until it goes dry. You take it for
Mm.
granted. So many times we take our health for granted, and then once there's a problem, then there's panic. Whereas if we have that mindset that my health is a sacred trust, and I need to not only take care of it, but I need to do the things, as far as I know, to strengthen it and to preserve it, then all of a sudden now you have the mindset that's going to secure your health. And it doesn't matter what comes up, because things will come up in spite of what we do. No matter how good a driver you are and how defensive you are, somebody may run a red light on you. And there you are. Make sense?
Mm.
So in life, things may come up in terms of health, in spite of what we do. But if we start off with the right mindset, then the moment it happens, we're looking from a position of hope, a position of trust, a position of looking at the stars. And how can I make the adjustments to correct this and make it better? So on that note, the thing that we need to do is consider the fact that we're always in a state of education. Yes, I know, and I know I don't like school either. And the word education is not a favorite word of mine. In fact, I have a saying, if I ever found the guy who invented school, we will have a serious talk. But in spite of that, we need to learn. We need to learn. And so we need to, the way to learn is to set up a system. It's easier to learn if you have a system. So what I tell my patients is set up a system, find a time. We all can find an hour a week. We all can find whatever fits our schedule and our need, and set that time as sacred time. Okay, yeah, this is my time to learn proactively what I need to learn in terms of my health. If it's learning to prevent cancer, then what do I need to be doing to prevent cancer? And the way we need to look at learning is almost like the pilot in an airplane. Now, if you are sitting waiting to board an airplane and you hear the conversation between the pilots and one of them saying, you know, I just look at half the instruments. How comfortable would you be getting on that plane? Okay. So in our quest as the pilots of our lives to prevent cancer, well, let us find out all the instruments. We don't have to learn them all at once. We don't have to look at them all at once. But if we set up a system where once a week, once a month, or whatever works for us, I'm going to work on this particular aspect and put
Mm.
that in place. And then I'll work on the other aspect and put that in place. Over months, maybe a year, you'll have a lot of things in place in your health insurance as far as cancer prevention goes. So if you think of those things and put them into practice in your life, then you have a plan, you have a system, you have a habit. Because most of the times things don't get done because it's not our habit. And so we have to make it a habit because it is that important. Now, it takes 3 weeks to develop a habit. It takes 3 months to consolidate that habit. And it takes a year before that habit becomes second nature. So if you're going to be developing the habit of doing the things that will help you prevent cancer and maintain your health insurance in that context, then you need to plan on a year of working on the things we talk about to put them into place where they become second nature to you, and you do them without having to think. So, Krista, you mind taking a moment now and giving us some feedback on those questions we had at the beginning?
Yeah, yeah. So Katie or Vanny, if you would like just to pop up the poll questions. So, audience, every day we show up to the end of supporting you and your learning, not taking you back to school where Dr. Ruckel went to school, but our own school where we can learn with some play and fun. So, we ask some questions to understand what you're seeking to learn through the session. So, the first question we asked was, how confident are you in your current cancer prevention strategy? And a majority of our audience, about 65%, are say somewhat to neutral. So they have something going on, but they're not very confident in it, which really says, looking at the stars, there's a lot of space to incorporate some new good habits. So we'll make sure we reinforce that as we go along. The next question we asked was, when was your last cancer screening? Um, and there's a variety of answers here. 20% of our audience is saying they've never had that. And I'm hoping that means 20% of our audience is very young without a family history. And then about 30% of our audience is saying they have within the past 6 months, and equal distribution after that. We did ask the question, have you ever leveraged DNA, genetics, any sort of testing to assess your risk? About 20% of our audience have done some diagnostic testing through a medical provider, 30% sitting within the consumer space. And more than 50% of our audience, interestingly, has not done any genetic testing when it comes to cancer prevention. So this evening, we'll ensure that Dr. Burkle and I will ensure that we can speak to a few different options you have when it comes to this sort of screening. The next question we asked was, what factor do you believe plays the biggest role in cancer prevention? And I adore our audience, Dr. Verkel. They are of a similar mindset. 90% of our audience thinks it's lifestyle choices. And beautifully research backs that up. I think most cancers, 80% of cancers, sit within that lifestyle space as opposed to some genetic anomaly that you do not have control of. The last question that we asked here is, what would you like to learn from this? Um, the highest response was how DNA testing will work for cancer prevention. So we will speak to that. Dr. Verkel will speak to that as we go along. Followed up by a close second, which genes impact cancer risk the most. So again, really influenced by how can we leverage our health insurance in order to support, or how can we invest in our health education rather, so that genes inform that prevention plan. Right, Dr. Burkle, I'm going to pass the proverbial mic back to you, sir.
Well, thank you. Well, thank
Yeah.
you. At least now we know who is here. We know a
Mm-hmm.
little bit about their experience, their involvement,
Mm-hmm.
their commitment.
Mm-hmm.
Um, so, like I said, it's not only an education, but we have to commit to continuing education. In our jobs, in my job, every 2 years, I have to put in so many hours of continuing education. Um, Now, not because I said I didn't like school, that's I didn't like education. I love to learn.
Mm-hmm.
And a lot of you, just based on the questions, love to learn as well. And the key is not only to learn, but learn the right things and learn the right things in the right way. Not only learn these things, but learn how to apply them. And not only how to apply them, but to apply them in the right way. So in learning, today we're going to learn. I always, again, have a way of saying, until you step back and look at the big picture, you really don't know what the situation is. Make sense? We need to step back and look at the big picture. Today we look at the big picture, including our genes, and see the part that they play. Because until we step back and see that picture and see where they come in our cancer prevention program, in our health program for cancer, then we really don't have the full picture. And without the full picture, we are flying our health plane or health life. We're not really looking at all the instruments, like I said before. And I keep repeating those because I want you to begin to think in those terms. When something comes up, say to yourself, these are all the instruments I need to be looking at, because the safety of my flight through life, the safety of my health through life, The safety of your life on that plane depends on the pilot looking at the instruments and looking at all of them and being aware of what they are, what they mean, and knowing how to adapt when things change on those instruments. So if we continue to look at it in that way, all of a sudden now we develop the habit, and the habit becomes second nature in terms of how we look at these things and in terms of how we apply them in our lives. So I will go through a series of what I call wellness, wellness, I'm sorry, wellness systems that we need to look at. They may not be all the systems that we need to look at, but those are things that we need to look at and look at them in our daily lives from all the areas, nutrition, lifestyle, and so on. But now look at them from whatever impact our genes will have on how they affect us. Uh, so I'll start. I have a way of fixing things in my mind, so they may not go in any order specifically, but the way I have them in my mind. So I'll start at the top. Okay, so the things we need to look at first of all is our mental health and our emotional health, because we may not realize that, but a lot of that has to do with its impact on us in terms of our immune system, in terms of our stress, in terms of all those things. It has an impact on our health, which has an impact on cancer. Okay, so many of us may have issues in terms of those kinds of things. But here is the thing with issues. I'll just give you a brief example of mine. I was born with a defective heart. I was born, in fact, at age 5, I had congestive heart failure. According to my mother, for 3 months, she would sit and wait for me to breathe my last. All my life through school, I was restricted from playing sports because of a medical condition with my heart. When I went to medical school, my heart was 3 times as big as the hearts of my friends, because we took x-rays, we looked at them, we did electrocardiograms. I had cardiomegaly. Now that was a long time ago, 50 or more years ago. If you look at my electrocardiogram now and you look at my heart now, it's normal. And you say, how could that be? Well, I say that only not to say how good I was in taking care of my health, but I say that to say we can do things regardless of where we start to improve our health. It may take a while, and many times, here's what happens. People have a tendency to say, I try that. If you get in your car to drive to a distance 4 hours away, and after half an hour, you say, well, maybe this car isn't working. I haven't gotten there. Well, it's a 4 hour drive. You have to keep your foot on the pedal for 4 hours. Many times, the things we need to fix in health is long term. It may take a year, it may take 2 years, it may take 3 years. But if we understand that concept, and again, have the mindset that I'll stick with the program until it works. You can always adapt, you can always change, you can always improve, but you have to stick with the program until it works. So many times from a mental health and emotional health, there may be issues and there may not be issues. And we can always learn to improve what we have. Again, a personal experience of mine. I came to America at age 20, and I knew I was going to be putting myself in a lot of stress, trying to get the money, trying to get to medical school, trying to get through medical school. At age 16, I began to learn how to manage stress. I began to read every book I could on stress management. So rather than wait until I got into the situation, I came into the situation fully prepared. So again, if you look at it from that standpoint, you don't wait until something happens. You anticipate. You educate yourself ahead of time, and you prepare. You are proactive. A wise man, like we said at the beginning, foresees the danger, hides himself, prepares himself. The simple pass on and are punished. In that connection, Krista, do you have any DNA?
Yeah, I do. I do. I find Sometimes people will come to me and they'll say, like, I've tried willpower or I've tried to focus on something and it's just not working. And there can be a sense of moral failing, like, why can't I keep at this? And I think to an extent, this is where genes can be part of one of those instruments that helps us fine tune our course. Because your genes will never per se determine willpower. That's something, you got to put your foot on that gas. But what I would offer instead, um, is that genes can teach us how easily our focus can be distracted, where our motivation comes in the sense of, do we get a burst of motivation, then it disappears, or do we have that consistent set of motivation, right? Your genes will really determine that. And so once you know what sort of propensities you have towards attention, towards even mood, right? How can you manage stress? Genes have a lot of insight there. So once you know that, you can kind of craft your plan against that. So for example, we have a gene called ADRA2B. It looks at how sensitive your noradrenaline receptor is going to be. And so people who have a more sensitive receptor tend to feel stress a lot more and a lot longer. And so if you know that, if you know you have this setup of ADRA2B, it changes how you go about supporting your stress. It changes when something stressful happens, the compassion you can offer yourself. So when I think to genes, Dr. Burkle, that support what you've just said, both in terms of how do I manage stress and how do I keep that foot on the pedal for the 4 hour car ride as opposed to just the first 30 minutes, I think to a lot of the genes in the mood and behavior portion of our DNA 360 that will educate how are you managing your stress and how is your motivation? Because once you know that, you can better tailor your plan and your instruments in the plane to keep course.
Mhm.
Yeah.
Okay, well, thank you. I like the way you explained that. Okay, next in the systems that we need to follow in terms of maintaining our health, preventing cancer is nutrition, the way we eat. Um, Lots of times, lifestyle nutrition, regardless of our genes, may help to preserve them and keep them from going off and causing potential problems, even though we have genes that may set us up for problems. So just being proactive in our nutrition, in our lifestyle, will go a long way in helping us prevent cancer. And on that note, Krista, you want to add something as far as specific genes?
Yeah. I'll start off by saying that I think there's a lot of trends when it comes to diets, and there's a lot of trends when it comes to cancer prevention. 20 years ago, it was juice this, juice that. Now, fasting and low carb tends to be in. And if you kind of look at those are kind of opposite, right? Juice compared to low carb. I would offer that the genes that you have, especially within our DNA 360, the diet nutrition section, could help guide that a little bit. They can help tell you, are you someone with a body that receives carbohydrate well or not so well? Do you receive fats well or not so well? And that can really create a bit more precision as to how you're supporting your nutrition and your diet in terms of cancer prevention. Because you're not going to, I would offer, I think there's cardinal things we can say. We can, Dr. Burple, I think both you and I would agree, junk food, not the greatest idea, vegetables, good idea. But beyond those generalities, there's going to be a lot of individualization that can be found within your genes. And so having access to that can be really helpful.
Good.
Yeah.
Next, let's talk about the microbiome. The microbiome has to do
Mhm.
with your gut. We just talked about nutrition, the food, we talked about the gut. Because the gut has a tremendous influence. In fact, two-thirds, almost three-fourths of your immune system is in the gut. And the gut has a tremendous influence on your neurotoxicity and neural system as well, in terms of the first thing we mentioned in terms of mental health and so on. So paying attention to the microbiome is important. And like I said, we should take the time to learn about our microbiome, learn how it functions, learn how to maintain it, learn how to restore it if there are issues with it, and then looking at the big picture, see how our genes may affect how we relate to it or it relates to us. So, Krista, you
Mhm.
want to add some insight on that?
Yeah, I think one of the more popular genes that are discussed here is a fellow called FUT2 that will really curate, especially, and this is from birth, right? These studies are done within mamas and babies, and it will really speak to, do you have the innate capacity to establish a really good biome, right? Or are you someone that might need to work a little bit harder and might be a little bit more prone towards dysbiotic, meaning not a great composition of bacteria within the gut? So knowing that can be really helpful. And I would also offer, if you think there's something funky going on in the gut, working with a provider becomes really important, because there's stool testing and there's diet and there's many other things that sit outside the genome that become really important in establishing that good balance that Dr. Burkle is saying will really contribute to sound immune system. And we know the immune system is so very important to keeping your health insurance up and your cancer at bay.
Okay, so in connection with talking about the microbiome, I'm going to sidetrack a little bit and talk about fiber, because many times fiber
Mhm.
gets shortchanged. And I tell patients all the time, if you're aware of it, the fastest growing cancer in America today is cancer of the colon. Now, fiber may not be the only thing that affects cancer of the colon, but it plays a significant role. And so we need to pay attention to fiber. We need to pay attention to getting enough fiber every day. We need to pay attention to the quality of the fiber we're getting. And we need to, again, educate ourselves to how we can benefit from fiber so we have that motivation to be sure we're getting enough fiber in our diet. So we need about 40 grams of fiber a day. If you're a diabetic, you need about 50 grams of fiber a day. So you need to work on that. You need to factor it in. And not sure if there's any genetic component that related to fiber, but at least I wanted to get that in because fiber sometimes gets short-changed. Um, in fact, since I brought up the subject of fiber, this is a little off topic in terms of cancer, but fiber plays a significant role in helping us manage our cholesterol as well. And managing our cholesterol goes a long way in helping our overall health and in a way helps with our cancer prevention as well. So if you keep that in mind, keep fiber in mind, then and make that a part of our education, a part of what we do in terms of our microbiome. Fiber provides the prebiotics that we need for the microbiome. And so it's important. And I just wanted to add that in there so that we keep it in mind. Another area of health we need to pay attention to is avoiding the toxins, because the toxins that we're exposed to, the toxins outside and the toxins inside. And when I mention toxins inside, I'm going to digress a little bit too, because we live in the environment called COVID. And spike protein is a toxin, and many of us have been exposed to COVID either by way of infection or by way of injection. And so that's something I mention it because sometimes that gets short shrift too when we mention the toxins we need to get rid of. So keep that in mind if you've been exposed and you're working on getting things improved and they're not improving. Maybe there's spike protein in the system that you need to pay attention to and you need to work on eliminating as well. So anything from a genetic standpoint, Krista, on
Yeah.
toxins?
Yeah. So audience, when I hear toxins, I really think about, unfortunately, it's inevitable we'll be exposed to them. Be that you contract COVID, I don't think anyone does that purposefully, or be that, you live near a highway or you eat food that naturally we find out now has microplastics in it. detoxing our body is something we need to be aware of. And where genes can come in really helpful here is educating you on how strong your innate detox systems are and your innate detox capacities are. Your body is beautifully redundant. There's several different pathways that support detoxification. We're not only reliant on one, body has many. So there's many different genes that will play into this. And so knowing of all these different pathways, this and that pathway are really strong. I don't necessarily need to support them, but maybe I should focus my energy instead on this pathway over here. That becomes really important because you're just being wise with your resources. So, genes tend to be a way that can really tell you you naturally detox this way well, you don't naturally do it that way well, so focus on that. And I think also for the canaries in the coal mines, which I consider myself one, it also gives you a little bit of comfort that it's not your fault. It's just that you're not strong in detoxing, and so creates a little bit of a plan of the while other people might be able to get away with it, I can't, and that shifts some of the health decisions that Dr. Burkle is encouraging you put some time around and invest habit energy into. Yeah, Dr. Burkle.
Okay, well, thanks.
Mm-hmm.
Okay, so another area that we need to look at is under metabolism is our blood sugar and our mitochondria. Now, many times, at least conventional medicine looks at cancer as a genetic disease. We need to begin looking at cancer as a mitochondrial disease. So when we mention the toxins, we mention all the other things that affect and damage the mitochondria, including the spike protein from COVID we talked about, because it's the damaged mitochondria that causes the cells to grow in an abnormal way. And once those cells grow in an abnormal way and grow in an amount that begins to overwhelm the system, then we say you have cancer. And things are done to fix the disease, but not much is done to uh, uh, to fix the cause. And the cause is addressing the mitochondria and doing things to support the mitochondria. So from a genetic standpoint, Krista,
Mm-hmm.
is there, as far as blood sugar goes, as far as the mitochondria goes, is
Yeah.
there any specific genes that you can help us with
Mm-hmm.
and help us
Yeah.
understand in the cancer prevention process?
So specific to mitochondria, I'll dip a little bit back and talk to detox genes. We look at two genes, one being SOD2 and the other being GPX. And these kind of think of them if your mitochondria is a kitchen that produces all this energy, think about them as the people that are washing the dishes afterwards. So these two guys really speak to how quickly you clean your dishes and how quickly you dry them off. And so those will be found in your DNA 360 report. And again, having suboptimal presentations there just shifts how you're going to focus on that sort of support. There's a lot of things that you can do to support the mitochondria. Dr. Burkle, I know we've had some conversations before, and so Vanny or Katie can link to some of those webinars so that they can dip into some of your knowledge there. When it comes to sugar regulation, right? Throwback again to diet and nutrition. And we have two different genes that we lean TCF7L2 and AMY1. Both of those really curate how your body experiences carbohydrate and the insulin response to it. And so knowing that again, it's not going to say will you or will you not have bad blood sugar, but how attentive you have to be. And in the wrong circumstances with the wrong diet, how quickly you'll develop diabetes or other like a mitochondrially influenced sugar ailment. Yeah, those are my genetic thoughts.
Okay, okay. Well, thank you. Moving on, moving on down the list here. Endocrine endocrine balance as a
Mm.
cancer risk. Yeah, we have an endocrine system, the thyroid gland, the adrenal glands, the sex hormone glands, and so on. And paying attention to those in terms of our cancer prevention is important because one affects the other. And lots of times they are the precursors of inflammation in our system. And inflammation plays a significant role in setting us up for cancer. So those are the things we need to add to our learning experience, what we need to do to manage, to take care of. And if indeed we have issues already with the hormones, of how to get them back into balance the way they need to be so that we can maintain our health and minimize our cancer risk. Any genetic thoughts on those?
Yeah. I think where at least our testing profile offers well to this is specific to sex steroid hormones. We do a really good job of assessing different hormone profiles from a genetic perspective. Is your body more inclined to be producing more or less androgens or estrogens compared to someone else, and how that can relate to risk of cancer, in particular in cancers that are influenced by sex steroid hormones. So for women, that might be breast, ovarian, men, that might be prostate. So knowing that profile can be very, very helpful, especially in terms of um, if you have a family history, right? There's so many people with family histories of prostate or breast cancer, and this can really help. It doesn't say you will or will not, but it really will curate how you might want to go about some prevention there. So that would be my thought from the 360. No specific genes there. I'd really look at the profile that you have because there's a lot of genes that feed into that profile, and it's usually a bit more beneficial to know the tendency as opposed to the specifics. Yeah. Back to you, Dr. Burkle.
Okay, so far so good.
Mm-hmm.
Circadian rhythm. That's a problem for many people. I see it in the office. Many people come and they have trouble sleeping. They have trouble falling asleep, staying asleep. And so we have to learn, we have to develop again the habit, the system, and there's a lot of information out there to help us learn sleep, how to sleep the way we should, how to get the rest we need to minimize stress, to help with our mental health, to help with our emotional health, and to help with our overall health as well. So again, I'm going to ask you from a DNA genetic standpoint,
Hmm.
um, what genes do you look
Yeah.
at when evaluating circadian rhythm and sleep issues?
Hmm. The obvious answer, and we do test for this, is a clock gene. Clock, aptly named, really speaks to how easily you can set up your circadian rhythm. The important part here is it's a question of ease. It's not a question of can you. So having suboptimal presentations here doesn't mean you can't have a circadian rhythm. It just means you have to work a little bit harder at it. And knowing as well, and Dr. Berkeley, I imagine you can attest to this, when people come in with sleep issues or circadian issues, rarely does it boil down to the exact same causes, right? For one person, it might be hormones, for example, menopause. For another person, it might be stress. They can't turn their mind off. And so, again, genes can kind of come in and they'll really speak to some susceptibilities there. You have a susceptibility to a bit of a hamster mind that will run over the same things and disrupt sleep that way. Or maybe you have susceptibility to poor hormones that don't support sleep. So I think there's a lot that can go into sleep, and our test will look both at the direct as well as some of the indirect. Yeah.
Okay. I think I've gone through most of what I had in terms of those areas of health that we
Yeah.
need to pay attention to as
Mm-hmm.
we work on preventing cancer. So, a few more things I want to mention that sometimes are not mentioned.
Yeah.
And maybe there is a genetic component to that as well. But in our nutrition, we didn't go into details, and we don't plan to go into details here, except to give you an overview and let you know that you need to step back, look at the big picture, pay attention to the genetics of it, and then follow the plan of setting up a program of education. And we can help you with that through our system here. Um, but seed oils, we
Mm.
didn't mention that when we talked about nutrition, but seed oils have a tremendous negative effect on our overall health. And seed oils have a negative effect in the cancer prevention space as well. Um, do you have any particular genes you look at, how they affect the
Mm.
metabolism of seed oils, or not necessarily?
No, no, we don't. We tend to do a bit more of the omega-3 indexing for this,
Omega,
but
okay,
yeah.
omega 3s as opposed to omega 6s. If we concentrate on the omega 3s,
Yeah,
then we cover the omega 6s.
yeah.
Okay. So the omega 3s, if we keep in mind, then um, we need to educate ourselves on the dangers of seed oils and the omega 6s, and we need to learn how to strike a balance
Mhm.
between the omega 3s and the omega 6s. Omega 6s, we need them, but we, because of our nutrition, because of the way we eat, because of the way we are forced to eat, because of the approach to foods in our country here, we're exposed to a lot more of those than we need to. So I'm going to mention a website, chronometer.com, chronometer.com. And that will help you, if you go there and familiarize yourself with it, help you monitor the omega 6s that you're getting in your system and help you um, decrease the
Mhm.
exposure to those and the negative impact they have on your health, and make that a part of your cancer prevention program as well.
Mhm.
Um, Not sure if you're familiar with the EWG.com.
Mhm.
Sure, many of you are.
Mhm.
But if you're not, that's another place you can go and get a lot of information in terms of toxins in your food, in terms of endocrine disruptors, in terms of those kinds of things, foods that are safe, the dirty dozen, the clean 15, those kinds of things,
Mhm.
that'll help you in your education and in your journey of cancer prevention.
Yeah. And Dr. Burkle, I wonder if you can spell out that Omega website for the audience once again. There was a question as to what it was called. Can you spell out the Chronometer website again?
CHRONOMETER.com. Chronometer, I'll spell it again, CHRONOMETER.com.
Wonderful. Thank you. And audience will have Vanny Arcadia as well. Put that in the chat so
Mhm.
that you can click on it there too.
So to wrap it up,
Hmm.
we haven't covered a lot of details, but I didn't intend to. My intention was to give an overview, an oversight. One, set the tone, set the mindset, because unless we have the right mindset of all the
Mhm.
things I mentioned, taking the approach, obviously, that this is our health insurance, taking the approach that it's a process. It's not going to get better overnight. It sometimes take years. I mentioned my heart, how it improved. That took 10 years. So
Mhm.
if somewhere in there I had decided I've tried it and what I'm doing isn't working, I would never have received the results that I did. So we have to have faith, faith basically is having the vision of our health, making the commitment, and having the courage to follow through. So
Mhm.
if I do nothing else but give you that overview, give you the encouragement, give you my personal examples to say, I am not just saying things, I've lived them. I can give you other examples in my life in terms of health, but I think the heart is a pretty significant one because it's very hard to reverse heart conditions, including heart failure and cardiomegaly. So
Mhm.
it can be done, and you can do it, and we're here to help you.
Yeah, I love that. I wonder, Dr. Brickle, do you have some time? The audience has a lot of questions for us. And so I wonder if you have some time for questions?
Yes, we have time for questions.
Perfect. Wonderful. Our first one is from Daniela. So Daniela is saying that unfortunately, a friend of theirs has been diagnosed with endometrium cancer, and their speculation is that it could have possibly been caused by HRT. So it sounds like this person who has the cancer has a history of supplemental hormone. Um, their question was, how could this have been avoided? Specifically, do you have any comment is as to did the HRT, the hormone replacement, influence the presentation of this cancer?
Oh, I have a personal experience to go along with that, and I think that the HRT has an influence. My first sister to die of cancer, she died at age
Mm,
40, and she died of cancer of the breast. But she
mm,
got into hormone replacement simply because she couldn't have kids and wanted to have kids, and was
mm,
told that this would be a risk, and she was willing to take that risk and
mm,
uh, paid with her life, leaving
mm,
a 8-year-old and a 5-year-old.
mm,
Um, how do you avoid that? I'm not sure. There are times and places when those things need to be done for whatever reason. Um, I am not sure if I have an answer for you as to how to avoid that. Many times it's done not giving sufficient thought to why it's done and the options that one may have outside of that. Um, but it is a tragedy, and it is a tragedy that many women face, and men sometimes
mm,
as well, because of the negative effect of hormone replacement on the cancer process.
mm. Yeah, I think this is why it becomes so important for that um, the patient to have a very good, open, and honest relationship with their provider, because that really means you can fully work through the history as well as what does it look the need for that hormone replacement. Because I think to your point, sometimes it is needed, and then other times it's something that really needs to be considered against the person's history. Yeah. All right. Um, our next question is from Shelley. So Shelley is asking, is it possible to learn about cancer in your body too soon? So, for example, if we found cancer and treated it with chemo or radiation, um, but because of in its early stage, it actually could have gone away on its own. So, Dr. Burkle, do you have any opinions on finding cancer too soon? Or I guess,
Okay, so yeah, the best time to treat cancer is before it happens, which
yeah,
is why we're here, which is what we're learning
yeah, yeah.
to prevent it. Makes sense? So if the best time to treat it is before it happens, then there is no finding it too soon, because the moment we find it, then we know we have to adapt what we're doing. We have to be a lot more aggressive in our approach to the cancer that's there. So, and I'm not sure if I quite understand the question in terms of too soon.
Hmm.
But yes, you want to do what we're doing now, learning the things we can to prevent it in the first place. And yes, we want to do the testing, the blood testing, whatever testing we need to do to monitor. Um, so in that connection, we need to be doing our breast exams. We need to be doing our testicular exams. We need to be doing our skin exams, visiting our dermatologist. We need to be monitoring our lab work and looking for signs of inflammation, the things that would clue us into there may be a cancering process going on in the system, because the best way to treat cancer is to prevent it. And then the second best way is to find it early and stop it.
Yeah, yeah. I think, Shelley, we have an interesting test where we're presented sometimes with this scenario. So we have a test called the liquid beat, which is a liquid biopsy, and it's a blood sample that will effectively scan your blood for DNA that is known to be associated to cancer growths. And so the interesting thing about this is between this test and science in general, we're discovering cancers earlier and earlier. And I would offer the beautiful thing about this is it allows for greater monitoring and greater awareness of, is the intervention working? So is it that the lifestyle and diet intervention, is that working to kind of help the immune system put it at bay? Or is it something that needs to be attended more frequently? Because I think to Dr. Brookle's point, prevention works because it supports the immune system in getting rid of it. And so the earlier we know that something is cropping up, the more intensive we can be with some of that proactive behavior instead of having to go at a later stage, right? A later stage when it has to be much more aggressive measures. Yeah. Dr. Burkle, Sue has a question for you. Sue, and this goes back to your conversation of fiber and the need for a renaissance around fiber. Sue's asking the question of what is the best fiber to be used?
Okay, so ideally, what I tell patients is what I mentioned before, we need to get 40 grams of fiber a day. So we start by looking at our foods that are high in fiber. And you can find lists of that. And you say, well, I already eat this. I can eat more of that. I can eat more of this. I can eat this twice a week instead of once a week. And all of a sudden now you are increasing your fiber. That's one. Second thing you want to be doing is reading labels. If you go to buy a product and it says 1 gram of fiber per serving, and this other brand says 2 or 3 grams of fiber per serving, then all of a sudden now you know that that is the one you're going to get because it has more fiber. Then the third thing I mentioned is adding fiber, and we can do that in a number of ways. We can do flaxseed as a source of fiber. We can do wheat bran and oat bran. Now, if you mix wheat bran and oat bran 50-50, wheat bran is hard fiber, oat bran is soft fiber, 50-50. You're getting half soft fiber and half hard fiber, and each has a different function in your system. A tablespoon of that will add 4 grams of fiber to your meal. So if you put 4 grams of that in your cereal in the morning, that's 4 extra grams of fiber. You put a tablespoon of that on your salad in the evening, that's another 4 grams of fiber. You put another 4 grams on your, another tablespoon in your milkshake, or you find ways, no, so you're making pancakes. So you add, you're making muffins. Okay, yeah, you find ways, just use your ingenuity to find ways to add fiber. And all of a sudden now you're getting more fiber and you're getting closer to that 40 grams of fiber a day.
Yeah, thank you. I hope that's helpful, Sue. Um, our next question, Dr. Burkle, is coming from Perlette. And this is going back to that conversation you had on seed oils and omega-6s. They were wondering if you could provide some examples of omega-6s. So where are a lot of people getting their omega-6s in their diet?
Okay, so I'm going to apologize. My screen was fading. I had to make a little adjustments.
Hmm.
So I missed a little of the question there. So if you
Yeah,
don't mind repeating it for me.
absolutely. Yeah. So, Dr. Burkle, the question is from Paulette.
Mhm,
And Paulette is asking, and this goes back to your discussion of seed oils and omega 6s. They
mhm.
were wondering if you could provide an example of omega 6s. So, where are people often getting omega 6s in their diet?
Okay, so if you think of the way we eat, okay, we eat at restaurants. You think of the way we eat. We buy packaged chips and all those kinds of things. If you look at the ingredients of almost all packaged foods, it'll tell you canola oil, it'll tell you, and so on, soy oil, all those oils. All those seed oils are omega 6s. All seed oils are omega 6s. So if we begin to pay attention to those kinds of things, then we can minimize and eliminate. Um, you go to a restaurant, most of the foods that are fried, most of the foods that are cooked, if the oil is used, it's seed oils. Seed oils have become ubiquitous in our society. Um, so it's paying attention and being aware that it's all around us and it's all there, and we just need to make the decisions and make the choices that minimizes our exposure to it.
Mhm. Yeah. Would you say it's fair? I know in the 80s and 90s, there was a huge push to eliminate salt, right? Table salt became a bit of a devil. And really what we over time learned was it wasn't necessarily table salt that was the issue. It was more to your point of going out to restaurants or having packaged food because they would have a lot of salt in there to either preserve or offer good taste. And so to an extent, it wasn't avoid salt, it was more do most of your cooking at home. Cook with real food as opposed to packaged food. Would you say a similar idea applies here with the omegas, the omega 6s?
Yes, the concept is the same. Yeah. Yeah, the moment you eat out, you guaranteed exposed to omega 6s. And so that doesn't say you shouldn't eat out. Makes sense? But what you can do is where you have control at home, minimize your omega-6 exposure, because again, it's the balance between omega-3s and omega-6s. So if you have to eat out and you have to do an occasion where you're exposed to omega-6s, but you know at home that you're doing your best to minimize your exposure to omega-6s, then let's make it let's make it reasonable. Let's enjoy our lives. Let's not go overboard. The whole idea is to make us aware so that we pay attention, so the things we can control, we control.
Mhm.
And the things we have no control, we let them be, but understand that we need to strike a balance. So when you go to chronometer.com, it'll help you see how you're balancing things out. Make sense? And help you in making those decisions as
Mhm.
far as your omega-6 exposure goes.
Yeah. Yeah. I like that. All right. Celeste has our next question. So Celeste is asking, what is the best way to determine which toxin detox protocol is needed or if it is even needed at all?
Okay, so let me answer the last part of the question first. Detox is needed. Make sense? We
Mhm.
need to detox. In fact, we need to develop a system of detoxing our livers and kidneys on a
Mhm.
regular basis because they carry the brunt of cleaning our systems.
Mhm.
And so whether they're toxins or not, they carry the brunt of cleaning our systems. And many times we don't know if there's an issue with the liver or kidneys until it's too late. Um, so just the mere fact that the liver and kidneys are the cleaning organs, we need to keep them clean. Make sense? Then the other thing we need to know is that we are exposed to toxins in our foods, in the air, in our skin care products. Yeah, we're exposed to toxins all the time. And so we need to work on minimizing our exposure to the toxins. And we need to work on cleansing ourselves of the toxins. And where the DNA genetic comes in is it helps us to know how well we are equipped to cleanse ourselves and what additional help we need in terms of toxins.
Yeah. I like that, because I think when you think to what protocol is appropriate, it's often a clinician that can support that decision, knowing both genes as well as what does your blood work look like? What is your family history? What are your exposures? Because I would offer, Dr. Burkle, to your point, all of those kind of play into how you want to be navigating the detox. Yeah. All right. Mickey has our next question. Mickey is asking, does the risk of hormone cancer from HRT also apply to BHRT? Audience, in a second, I'll differentiate what she's saying. Does recent research show increased risk of cancer with a combination of estrogen and progesterone? So what Mickey's getting at, HRT stands for hormone replacement therapy. BHRT is bioidentical, and it really speaks to a bit of a shift from when historically a lot of hormone replacement was derived and not or synthetic and not mimicking bioidentically our hormones within, to more of a shift of hormone replacement where the hormone you take in looks very similar to what your body creates, and so your body responds in a similar way. So Dr. Burkle, is there a risk of hormone cancer in light of BHRT, different from HRT?
Yeah, the risk may not be the same, but there is risk. Many cancers are estrogen driven. And so the more exposure there is to estrogen, and what we may not realize is a lot of the chemicals that we're exposed to have an estrogenic effect. And that estrogenic effect may not be in terms of estrogen, but an estrogenic effect in terms of how it affects the body's response to developing cancer. Makes sense? So anytime, if you think in those terms and you're working on a cancer prevention program, you want to minimize any estrogenic effect that may have an influence on any cancering that may be occurring in your system. So whether it be HRT or BHRT, you want to factor that into your cancer prevention program in terms of its estrogenic effect, not necessarily on the ovaries and those kinds of things, but on the impact it has on cancer itself. Because many cancers are estrogenic in their origin and behavior.
Wonderful. Thank you. All right. Diane has our next question. Is diverticulosis, is that a precursor to colon cancer? So perhaps maybe if you want to start by dissecting that multisyllabic word for the audience.
Okay, so let's talk diverticulosis. Okay, yeah. Okay, so here's what happens. Here's what diverticulosis is. Diverticulosis is little pouches that develop in the wall of the large intestine because of recurring pressure. So if you're suffering from constipation or any of those kinds of things, you have a tendency to weaken the wall, and little by little over time, little pouches will form. Those pouches aren't necessarily precancerous pouches. They may be a potential problem in causing diverticulitis, which can be, or in perforating, which can cause sepsis and those kinds of things. But as far as I'm aware of, they're not necessarily a cancer-causing issue. What you want to be doing, if that's an issue, a problem, then you want to do, as you were told, minimize, small seeds and things that'll block them, because that's what happens when they become diverticulitis. They get blocked and they swell, like the appendix does, and you get appendicitis, diverticulitis. The concept is the same in terms of being swollen and having the tendency to rupture and cause infection and sepsis and so on. So to answer your question specifically, no, as far as I'm aware of, they're not precancerous lesions. Now, polyps, on the other hand, are. And that's why, as a part of your cancer prevention, you want to get your colonoscopy tests as directed.
Mhm. All right. Christy is asking a question. I couldn't hear the last two genes listed. Do you have a list of genes to look at as far as cancer goes? And Christy, I'll be very specific. The DNA 360 is not a test that diagnoses cancer. What it really teaches you is about your body, in particular parts of your body that need some support in order to see their fullest versions of health. So, for example, do you have genes that predispose you to diabetes? We know that high sugar can be a contributor there. So I would say if you're looking for a list, all of the 360 arguably is, but it's a list that can be curated better with when you work with a practitioner who's able to take that health history, that is able to take your your health history as well as what's going on in your world right now, so that as Dr. Burkle is really beautifully articulating and making the case for, you can work on that prevention plan, that proactive plan that is informed by the instrument of your genes as to what you need. So if you're looking for someone to support that understanding of your genes, don't hesitate to reach out to us. The email you can use is ceo@thednacompany.com. That goes directly to Tracy, and she, I promise, will answer at almost all hours of the night. Dr. Burkle can attest to that. All right. Let's see. The next question I have here, Dr. Burkle, is from Sue. And Sue is asking, what are your thoughts on extra virgin olive oil?
Extra virgin olive oil. Yeah, extra virgin olive oil. If obviously we need oils, we need fats, and extra virgin olive oil, I think, is an ideal oil to use in terms of our cooking and food preparing and our salads and those kinds of things. So I think it's an excellent oil, and I recommend that if you haven't yet, make it a part of what you do.
It's also one of the wonderful instances of health being very tasty. I enjoy when the two goals meet. Okay. Katya, Katka, I hope I'm saying that correctly, has our next question. So Katka, I'm going to split your question into two. Katka kind of came in and asked, are we going over specific biochemistry here? And we haven't gone over that level of detail. If that's a level of detail you're looking for, I'd really encourage you coming out to dnau.com. That's the more academic arm where we would be diving much more into biochemistry. Your second question here, though, is Dr. Burkle, Katka was wondering if there's a place for high dose vitamin B1, vitamin B3, vitamin B6, so high doses of that in regards to cancer care or cancer prevention?
Um, if there is, I'm not aware specifically of high doses of B vitamins in terms of cancer care, cancer prevention specifically.
Mhm.
I see them playing a role if in nerve issues, simply, and nerve issues can lead to cancer. So it's more of a secondary role than a primary role in terms of cancer. But if you have nerve issues in terms of nerve damage, if you have nerve issues in terms of uh, um, neurotoxicity, if you have any of those kinds of things, then the B vitamins play a significant role in healing the myelin sheath and in supporting neural function. Um, so if secondarily those have a detrimental effect on the system as to causing cancer, then I see that as where extra B vitamins would play a role as opposed to specific in cancer prevention. Yes, you need the B vitamins and you need them in adequate amounts,
Mhm.
but no extra in terms of cancer prevention.
Wonderful. Thank you. Uh, Nicole has our next question. So Nicole is saying their 17-year-old niece, unfortunately, was diagnosed with and is currently being treated for an ovarian tumor, a very large one, volleyball sized is what they're saying, that was biopsied as cancer positive. Um, they're saying that this niece lives next to a massive power station, and they're wondering if there's a role in EMF or that, I guess, that proximity to the power station, that exposure and cancer.
Okay, yeah, that's a good question. Power station exposure, as far as I know, affects brain tumors, but I'm not aware of it affecting ovarian tumors. Um, Now, it may have had an estrogenic effect, not necessarily in and of itself, but nothing is pure. Makes sense. So it may have had an effect uh, working with something else, complementing something else in stimulating the tumor. But as far as I'm aware of brain cancers, in fact, kids who grew up in those kind of environments have a higher incidence of brain cancer than otherwise. But I'm not familiar with as far as ovarian cancer is concerned.
Thank you. Diane has our next question. Um, Let's see, and this actually might be a question for me. What are your thoughts about the new blood test that Gallery puts out that offers testing for over 20 types of cancer? Is it effective in correctly identifying cancers? Is it, it's probably not a replacement, but rather a complement to regular screenings, correct? So the DNA company has partnered with Gallery to be offering this test. It is our liquid B test. And so for the audience's awareness, again, it's a serum test, a blood test that you take. And very crudely, it scans the blood for DNA and it says, hey, we see a fragment of DNA in large number that's similar to this cancer sort. One of its strengths in particular is it will screen for a lot of cancers that aren't otherwise screened for. So for example, with breast cancer, we know we do mammograms on a frequent basis. Or maybe there's colon cancer testing with kits, etc. So one of its powers is it screens for things that don't really have screening guidelines, as well as we mentioned, it can catch things really, really early so that you are brought in for treatment sooner. So I would say there's, as part of that toolkit, this can be a really strong add-on, as it does not diagnose cancer, but it can really prompt someone to get more pointed follow-up. In particular, if body is starting to show a little bit of evidence of a cancer popping up that is not being well managed by the immune system. Dr. Burkle, did you have any other thoughts there on the Gallery test?
Not really. Simple blood tests, monitoring the CPK, the LDH, the ESR, and the lymphocyte, neutrophil lymphocyte ratios can clue us in into early signs of inflammation that may prompt us, if there is concern of cancer, to look into it. So just the regular simple tests that you get routinely at your doctor's office, um, if you're aware of what to look for and aware of the tests that they do. And since you mentioned that, I think an important test to look at is vitamin D. Many times that doesn't get done. And many times we don't supplement with our vitamin D as we should. Where vitamin D plays a critical role in our immune system, which plays a critical role in cancer prevention as well. So sometimes, yes, we do and I don't want to use the esoteric in a wrong way. We do the fancy tests, but let's not neglect to look at the everyday tests that we get done in our doctor's offices and be aware that there are subtle things we could learn from those as well.
Yeah, yeah, I agree. Things that will prevent, even on that Gallery testing, any upcropping that we don't want. Yeah, thank you, Dr. Burkle. Our next question is coming from George. Is there a cancer danger or risk from an untreated hernia in the groin area?
Um, I'm not aware of a cancer risk of untreated hernia. I assume it's untreated because it's not incarcerated. If it's incarcerated, that would be a problem. That would be a life and death problem. Um, so areas where there's chronic irritation causing chronic inflammation can be precursors to cancer. But if it's a hernia, then there's probably no inflammation. And so there's no greater risk. I would suggest you get the hernia fixed. But to answer you specifically in terms of a potential precursor to cancer, I'm not aware of that at all.
Irene has our next question. Irene's asking, is there anything you can do apart from diet to deter polyp growth in the bowel?
Apart from diet, I am not aware of anything specific you can do as far as, and diet would incur taking care of the entire microbiome. Makes sense? Yeah. So you would want to be sure that, from stem to stern, things are in order in terms of the esophagus, in terms of reflux, in terms of your H. pylori issues, in terms of all those things. Obviously, the polyps are way downstream in the colon. But I would think if there's any potential negative influence and the microbiome is in good shape, I think that would minimize that impact. So in addition, or besides your question specifically, besides diet, is take care of your microbiome.
Beautiful. All right, Dr. Burkle, our last question is coming in from Cynthia. Uh, does microscopic colitis increase colon cancer risk? It sounds like this person is in remission now. And so I'd speculate remission from a colon cancer.
So I'm going to ask you to repeat. I missed a few words at the beginning. Is microscopic?
Uh, does microscopic colitis increase colon cancer risk?
Okay. So colitis is inflammation. Anywhere there's inflammation, there's increased risk. It may be microscopic, but there's inflammation. So anytime there's inflammation, there is a risk. It may not be a big risk, but there is risk. So if there are ways to minimize that, if there are ways to correct that, then we need to look into that.
Great. Well, thank you. And that beautifully brings us to the end of all our questions. Dr. Burkle, I'm very grateful that you joined us. In particular, I'm very grateful the way you kind of opened it up in regards to mindset. Because I think something I often hear people, or at least witness people sometimes, they want to take a proactive approach to health, but in that 4-hour journey, their foot comes off the gas after 30 minutes because it feels like either too much or it's not actually going anywhere. So I'm grateful you started off that conversation in a way that makes everything that we've discussed here today a little bit more accessible. Did you have any closing thoughts for our audience?
Yeah, I want to thank everyone again for coming. I want to thank you for your interest. I want to thank you for all the questions. It tells me that obviously you are aware. Obviously, you feel that your health is important. Your health insurance is important. We talked about earlier. And I want to wish you every success in your journey to cancer prevention and health.
Yeah. Right. Well, on those beautiful words, audience, thank you so very much for joining us. We look forward to, we're on Tuesday through Thursday doing these things, so please join us again. And again, thank you very much, Dr. Burkle. We really appreciate it. Okay, I think
You're
it's time
welcome.
for us to bid everyone adieu. Bonsoir, mes amis. Bonsoir.
Bonsoir.
Au revoir. We sometimes dance out, Dr. Burkle. You're welcome to dance if you want. Exactly. You got to be healthy and happy.